Hi, I'm Missy Creed, a librarian from the Library for Health Information, or the LHI. The LHI is a consumer health library located in the Ohio State Wexner Medical Center in Columbus, Ohio. The LHI provides free, reliable, easy to understand health resources for medical center patients, their families, and the community. Medical center clinicians can also refer patients to the LHI if patients are interested in finding more information on their own about their health diagnoses. Today, the LHI is highlighting diabetes. We are chatting with Jenny Shrodes from the Ohio State Wexner Medical Center's Diabetes and Metabolism Research Center. Jenny is a diabetes educator. I'm going to let Jenny introduce herself, the Diabetes and Metabolism Research Center, and maybe share an interesting fact about herself. Jenny?
Hi, thanks for having me today. I'm Jenny Shrodes, and I am a diabetes educator for the outpatient care at Ohio State. And an interesting thing about myself is that I've cooked in the Culinary Institute of America kitchens in Hyde Park, and I won first place in the cooking contest.
Wow, congratulations.
Thank you.
I read in the spring 2020 edition of the NIH Medline Plus magazine about prediabetes and diabetes. Jenny, could you tell us what prediabetes, type 1 diabetes, and type 2 diabetes are?
Absolutely. Any kind of diabetes is an indication that blood sugar is too high or above the normal parameters. Type 1 diabetes means that a person's body does not produce insulin anymore, and therefore they have to inject it. Insulin is what helps us store our sugar and use it for energy. Type 2 diabetes is an indication that blood sugar is too high. However, at the beginning of this condition, people are still producing insulin. Over time, they may not produce insulin and they may need to inject insulin. Prediabetes comes before type 2 diabetes, and it's a slight elevation in overall blood sugar that can usually be addressed with lifestyle changes.
Thanks. Who gets diabetes?
Oh, good question. There is a huge hereditary component to this. So with type 2 diabetes, we expect that somebody who has a family member with type 2 diabetes is more at risk. And also the other risk factors for type 2 diabetes are leading a sedentary lifestyle, carrying extra weight than is ideal. And certain ethnicities are prone to getting diabetes. And then type 1 diabetes is a little bit different. We have lots of people who have diabetes whose parents don't have type 1 diabetes, and they have no idea of any family member who has had type 1 diabetes. But it's kind of like winning the gene pool. Both parents had to donate that gene for the person to have diabetes.
What are some signs of diabetes?
Well, the telltale signs are somebody who all of a sudden is very thirsty and drinking lots of water and probably urinating more than usual. Lots of people report that they feel very tired because when you have high blood sugar that's uncontrolled, that fatigues your body.
I've heard of blurry vision and losing weight as well. Could those not necessarily be the top indicators, but indicators that, hey, I need to go see a health provider?
Yes, absolutely. It certainly depends on how long you've been having the high blood sugar, but you're right. Weight loss is an indication, and blurry vision is something that people tend to experience when they do have high blood sugar.
Thanks so much to Jenny Shrodes for joining me today. For more information about the Diabetes and Metabolism Research Center, please call 614-688-6251. To obtain copies of some diabetic-friendly recipes, please contact the LHI. For more information and free handouts on diabetes, please contact the Library for Health Information at health-info@osu.edu. To learn more about the Library for Health Information, please visit our website at go.osu.edu/hsl-lhi. See you next time.